Thank you so much, Denisha, for going over the first part of chapter 13. My name is Kendriana McCullum, and I'm going to finish out the chapter. So, to start off, we're going to talk about our collaboration skill, which shows us how teens mature along a clinical continuum. At the lowest level of interdependence, we have information exchange, which is simple one way lateral updates. Then, next, we have consultations where we actively seek out a specialty's expertise. Next, we have referral, which is transferring specific tasks when a patient's needs exceed our immediate scope. And lastly, we have co management, which is characterized by shared clinical goals and mutual accountability. So, to better understand how to build these high performing partnerships, we look to comprehensive team effectiveness framework. So, I'm going to give you the meat and potatoes of the success pyramid. So, the pyramid shows us how success starts from the bottom and it goes all the way to the top. At our bottom, our foundational level, we must have clear roles, supportive leadership cultures, and organizational conditions that reinforce teamwork. On top of foundations, we have our ABCs, which stands for our daily attitudes, backup behaviors, and cognitions. So, our cohesive, shared mental model of care. So, when you have your ABCs and your foundations locked in, this is whenever we can reach the ideal states, which is absolute psychological safety, mutual trust, and resilient adaptability during crisis events. So, if a clinical unit is struggling with safety, then we have to start all the way at the bottom and figure out where do we go wrong. We need to fix the foundational role clarity and leadership structures first. How do we put this into our daily practice? Let's go over the communication playbook. We need to be able to do an SBAR, which stands for situation, background, assessment, and recommendation. Your SBAR should be 60 seconds or less, and it needs to be concise and also clear and accurate. So we're going to try to cut down the rambling. Next, you have your CUS escalation, which stands for concern, uncomfortable, and safety issues. So we're going to use structured safety keywords, such as I'm concerned about the patient's blood pressure. I'm uncomfortable with the current orders. I believe this is a safety issue. You are triggering an organizational safety protocol that forces the team to pause and review. So let's do a quick clinical scenario. You're monitoring a post-op appendectomy patient on the floor. Suddenly they look at you and gasp, I can't catch my breath. You immediately take their vitals. Their respiratory rate is 28 minutes breaths per minute, and their SATs has dropped to 88 on room air, and the attending physician has not rounded yet. So let's do our SBAR. I'm calling regarding a post-op appendectomy patient in room 402 who is experiencing acute shortness of breath. The patient is a 45-year-old male, status post appendectomy 6 hours ago with no prior pulmonary history. His respiratory rate is currently 28 breaths per minute, and his saturation has dropped from 98 to 88 on room air, and he is visibly struggling to breathe. I recommend an immediate bedside evaluation in order for stat oxygen therapy and a portable chest x-ray. So, how do you think I did? I think I did pretty good. Standardizing this communication in your mind ensures that when you call a provider, you deliver life saving clarity under 60 seconds. As we wrap up this presentation, I want to discuss how we can bring this into our future roles as new grad nurses. We must turn these concepts into our daily habits. So, before care, we want to huddle with our clinical preceptors and team members and ask, what is my clear role today? During the care, we're going to use names, practice closed loop communication. If a provider tells you, hey, I need you to get this medication, you're going to repeat the order. I am giving back 5 milligrams of blank. Is this correct? We're going to verify, confirm, and cross monitor. After care, we're going to participate in debriefs, reflect on what went well, and also what can we improve in, always include the patient and their family as core members of the care circle. So here is all our references, and we use these sources to form an evidence-based foundation for our presentation today. Thank you guys so much for listening.